Hi there, I'm Dr. Shauna Daru, and thanks for joining me live today. So I wanted to check in today and talk about cortisol and high stress levels. So we live in a time where we're always on the go and our stresses are turned on, and we have demands in all directions. So as women, we may have families and children and work stress and career stress and financial stress and all of that. And culturally, we're supposed to always be on and checking our phones, our emails. There's an endless list of things to do. So what that results in for many of us is that our cortisol, a hormone that helps to regulate your stress response, becomes chronically turned on. So I just want to distinguish here, when I'm talking about high cortisol, I'm not talking about Cushing's disease or Cushing's syndrome, which are conditions that are very serious medical conditions of extremely high cortisol. They can be caused by tumors or autoimmune processes. So we're not talking about that at all. We're talking about physiologically high cortisol levels, which is a stress response. And the thing is that our bodies don't know how to turn off the stress when it gets turned on. So we live in this state of chronically doing, and when we do get a break, our brains are still racing. The list of things to do doesn't stop. Our bodies are restless and we can't actually settle down. So it's been estimated that like 70 to 90% of all visits to primary care physicians are due to stress-related illness, which is pretty astounding. So there's a lot of motivation to tackle this stress and to tackle the chronically elevated cortisol levels. I wanted to talk about a lot of the ways that the high cortisol can affect your health, because sometimes this is actually the motivator to start making some changes. And then at the end of the video, I'll go briefly through some tips and ideas to help to turn off this chronic pattern, and we'll address it more in another video after. So one of the really interesting things about high cortisol is that it has an influence in turning on some of the disease-causing genes. Now, this is a really simplistic way of saying it, but we all carry genes that can cause disease, and if you are in a chronic state of high cortisol, it can activate the disease expression of some of these genes. So that might be increasing your risk of getting Alzheimer's disease or breast cancer or manifesting an autoimmune disease. And on the other side, it's interesting that meditation has been studied to turn off the same types of genes. So there definitely are strategies within our control that we can use to affect our gene expression. And this is a big one, because what that means is that the stress could affect anything depending on where your weakness is, which is also why for some people stress has a bigger impact on their mood, for others on their gut, for others on their hormones, for some people with inflammation and joint pain. It just depends where your susceptibility is. So stress and weight and metabolism are very tightly connected as well. And this is related to an increase in your appetite when you're under stress. So it affects the ghrelin and leptin levels, which regulate your hunger. So you will constantly feel hungry. Now, this is the chronically high stress state, not the panic, high adrenaline, fight or flight, in which case most people do lose their appetites in that. But the chronic high cortisol state, I would say that most people experience being more consistently hungry. So the other way that it affects your weight and metabolism is through blood sugar levels and insulin. So high cortisol levels actually triple the insulin response to your carbohydrate foods, to sugar, to fruit, to juice, and to alcohol. So what that means is that it's like they count triple. So for example, you're eating one apple, which seems like a very moderate amount of fruit, but your body's registering it as 3 times that much in terms of its insulin response. And what insulin does is it tells our body to store those calories as fat. So again, when your body is under this chronic stress, you're going to be storing more weight, and especially weight around the middle abdomen, so the stress belly weight. And the best way to start to target and lose that is to actually deal with the chronic high cortisol. So another way that cortisol affects your health is by affecting your digestive tract. So it can lead to just reduce blood flow to your digestive organs. So you will end up with more acid reflux, more bloating, gassiness, stomach upset. So just think what we classify as IBS. Often it isn't really a food response, and it's not really, a food intolerance or other things going on. It's the impact of your digestive system not having enough blood flow, and it needs to relax to digest. So if we think about it from the two branches of your nervous system, the sympathetic nervous system and the parasympathetic nervous system, the parasympathetic nervous system regulates your relaxation response, but also digestion. We digest in a state of rest and relaxation. So if you are thinking and doing and going all day long, it would be unbelievably unexpected to have great digestion. So another way that stress affects your health is by impacting your hormones. Your hormonal system is all integrated. So think of it like a giant web where one set of hormones affect your reproductive system, it affects your thyroid, it affects your blood sugar regulation. So they're connected. And when we're living in a state of chronic high cortisol, some of the more typical ways that it manifests is it can slow down your thyroid hormone utilization. So it's your body's way of protecting you. So your thyroid will slow down to make you rest more. So it's sort of trying to turn it off. Cortisol will also impact your progesterone response, making it harder to get pregnant. And there are other mechanisms also with fertility that can come into play. Now, I would never blame somebody's infertility 100% on stress. The way I look at it is that stress will amplify whatever the underlying imbalance is. So again, blaming yourself for being too stressed is never the best way to approach it. But it is really important to take steps to manage the stress hormones and to get out of the chronic high cortisol state. So another impact of high cortisol is on your immune system, and specifically related to cancer expression. So what one study showed was that with chronically high cortisol, your natural killer cell production can drop as much as 56%. So what that means is that our bodies become more vulnerable. So cellular changes can happen on a regular basis, but our immune system is there to clean it up and to prevent those cells from aggregating or developing or progressing. So if your natural killer cell response is depressed and depleted because of stress and other factors, then it's giving more of an environment that cancer can thrive. And it also impacts survival from cancer. So this is something that's absolutely essential that we address, in part of the treatment plan for somebody who's recovering from cancer and cancer treatments is to make sure that we're treating the stress response as well. So again, this is meant to just give you some awareness of how the chronic high cortisol can affect your health. And there are definitely a lot of solutions that we can go into to turn off that response. I'm not going to go into supplements right now, but I will on another episode. So a few strategies that are really, really important. Number one is building in breaks. And that means breaks in your day, breaks in your week, and breaks in your year. The best way to turn off a stress response is to give yourself a break. And, a conscious break during a work day will prevent you from being frazzled by the end of it. So an example of that might be to get some fresh air, to go for a walk at lunchtime, to socialize, anything except eating at your desk and staring at your computer for longer. Now, I know a lot of you work through lunch, so you can get home at a reasonable hour. So just look to see if you can be creative with at least a 10-minute break every few hours, where you relax your shoulders, breathe fully, and try to deactivate the stress. Another thing that I find really helpful is to try to pay attention to the rushing and the hurrying. So when we're rushing, we're activating a stress response. And this is something that with awareness we can change quite dramatically. So if you can give yourself a little bit more space to get where you need to go and not rush and hurry to get there, that's an enormously powerful tool. Getting enough sleep, really important. We'll talk a lot about sleep in another episode. Watching the type of exercise you do. So if you are one of these people who's constantly chronically going, a high intensity, high duration workout is probably not the right one for you right now, because what that does is it turns on more stress. So if you are running your life constantly and you feel like this stress talk talks to you, the best forms of exercise are the gentle to moderate types, meaning cardio where you can breathe quite easily. You'll still work up a sweat, but talk to your neighbor and smile. So not something that's a super high intensity workout. Watching the type of exercise, eating regularly, keeping your blood sugar stable is a huge way of reducing your stress. And of course, having a daily practice. So this could be meditation, which has been studied to turn off this cortisol response. It could be a guided meditation or a guided imagery exercise. It could be breathing. It could be a gentle yoga practice, walking in nature. There's a lot of ways of activating the relaxation response, but really important to do this regularly. So regularly in your week, regularly in your day, and building in some downtime in your year as well. Thank you so much for joining me. This has been just a short discussion about cortisol, and I'll be back on later this week to talk about sleep next. Have a wonderful day.